What's up? It's CJ Sparks. Welcome back to my YouTube channel. So today I am back in Las Vegas and I am back at Dr. Corsandi's office. Oh my gosh. So everything went great. CJ 2.0 is in full effect. I am healing nicely. Everything with what Dr. Corsandi previously did is fantastic, 10/10. However, while we were doing my face fat grafting, we were talking about some scarring that I have had previously. I have to be honest, I don't think I took care of my lip lift as well as I could have. And as a result, this lip lift scar has kind of always bothered me. It was definitely something, if you get surgery on your face, you have to be diligent. And I just don't think I was. And this scar has been bugging me a little bit. And so Dr. Corsandi has offered to go ahead and handle that for me. I am so excited. He was able to get me in right away. So I am super excited to be back already on a fresh new journey. For today, we are actually also going to be doing an ultra clear, which I'm very interested to see the results. I've seen pictures where some of these people look like they are at least 10, 15 years younger. And while I take pretty good care of my skin, I am in the sun. I told you guys last time, put your sunscreen all over, slather it on your neck, on your chest, especially the ladies. And I just haven't done that. And I've never done this. I've done Morpheus on my face, which is not a laser, but it's like a kind of extreme facial. You might have heard about that. Definitely recommend it if you haven't tried it. But Ultra Clear is like super multiple steps up, and I will have a little bit of downtime. My face will be healing and peeling and pink and fresh and tight, but I might look a little scary for the first couple of days. So since we're gonna be cutting into my face, into my top lip area, I figured why not go ahead and do that as well. So I have to be honest, I am a little nervous. I am only going under like a local anesthetic. I'm not gonna be put all the way under for this lip scar revision. Oh my gosh. Yeah, we might have to cut the camera. I don't know. I'm gonna film as much as I possibly can, as much as Chris will allow me, the cameraman, before he gets too woozy. I think he's gonna be great. I have all confidence in him, but I'm a little nervous. I'm really grateful. I know Dr. Corsandi. I'm in the best hands, and he does stuff like this all the time. The beautiful thing about going under a local aesthetic, it's very fast. It's probably going to be about an hour procedure in and out. And I am not going to be put all the way under, so I won't get like the shakes and the chills. If you've ever been put all the way under, oh my gosh, you're so disoriented afterwards. And it really takes a long time for you to come out of it. And it's just totally uncomfortable. So I'm so grateful. The price is much better as well. So if you're someone that can't get to Vegas for your plastic surgery, but you want to see if your local plastic surgeon will offer something like this, I would definitely encourage you to do your homework. However, it is typically 9 times out of 10 a much better price. If you're interested, you can go ahead and call the VIP office here and they will give you a little quote. Yeah, so I'm super nervous. I feel like I'm actually more nervous for this than the last one because I was just getting put under. My only job was to go to sleep and lay there and just hang out. So this one's gonna be a little more involved. I toyed with the idea actually of not sharing this because I truly don't know how I'm gonna react, but why not? Why not, right? Just put it all out there. And yeah, hopefully I can just give a little bit of insight into something like this. The recovery, from what I understand, is going to be pretty quick. It is going to be in like an open wound situation that we're going to be sewing back up. So of course there will be recovery time. But yeah, I'm just going to kick back again for a few days and CJ 2.0 continues. So that is all. I am actually numbing. I have a little bit of numbing cream, and I imagine I probably might get some some pills or some shots or something. I don't really know. Like I said, this is my very first time experiencing something like this. I am nervous. I am excited. I know I am in the very best hands. So I guess next cut might be actually me getting cut. So stay tuned.
You see that the nostril has a sort of natural curvature all the way around, and it's got a nice roundness. It's hard to recreate that. You can see it's round over here, but it also has a roundness that comes into the nostril here. And there's a little, what we call a nostril sill. Now you can see, tuck your lip in. You can see where the scar is a little bit better when she does that. And you see these little kind of areas in which the suturing kind of left a little bit of a line. And I think it looks good, but under certain lighting, you know, this looks a little bit deep, this looks a little bit, you know, whitish. We'd like to improve it a little bit. And I think the best thing to do in these circumstances is to re-incise this area. And you can see, tuck your lip in a little bit more. You can see it here, this little shadow. Relax now. Now, normally, there are 2 or 3 different types of noses here. Some have really a flatness right here. So this nostril comes all the way down and stops right here, and it's flat in there. And you can take that lip lift and push it up into there and hide the scar in there. But CJ has a nostril that comes around. Relax for a second, try not to smile. There you go. That comes around and attaches over here. So that roundness comes all the way around. And what you really want to do is hide that in this space right here. So now when I do this, if I put that stick there, the Q-tip, right, you don't see any scar, right? And the idea is to make it look like that. Take out those little areas where it widened a little bit over time and remove them and hide them in this little space, in this natural shadow space. Okay, so in addition to a little minor scar revision, we're going to do some laser resurfacing for CJ. And the type of resurfacing that we're going to do is an ablative fractional laser. And my state-of-the-art laser today is the ultra clear laser. What this laser allows us to do is to target those areas without heat, right? And then we can control the depth of the laser in 2 layers. So there's a deep, kind of what we call a drill point that goes really deep into the tissue, gets down to the lower level of the dermis, and it's a really tiny, narrow beam, really kind of tiny, almost like a needle point. And then there's a ring around that. It almost looks like a target. So you have a little central part that goes deep, and then the area around it will work on the upper layers. And we can control how deep the ring goes and how deep the drill point goes. Being able to control those 2 different parameters allows us to treat many different skin conditions and to treat them safely. Because we're able to really dial down the heat to almost 0 with this, you don't need any sort of special medications, you don't need to block the face. We're just going to use some topical numbing cream that's made of benzocaine, lidocaine, and tetracaine. It's a combination, it's 3 different compounds. Some act quicker, some last longer. We'll apply that for about 30 minutes, allow it to kind of penetrate into the skin, and then we'll be able to do our laser in a way that's nearly painless. Now, later on tonight, since all these little tiny openings are there, we're going to treat it with an antiseptic throughout the day and throughout the evening. And it may feel like a sunburn in the evening, right? And that usually resolves by the next day as those things close up. And what we'll see is that for about 3 to 4 days, you'll see this coloration that turns first from a red to a red-brown to a brown. And then you'll see this tissue kind of just flake off, right? Underneath, after 3 to 4 days, you're going to have some redness. And that redness is like a light sunburn, and that's the inflammation that comes from healing. And that usually lasts about 3 to 4 days as well. So all in all, this is about a 1-week downtime, and I'm able to get as good, if not better, results than a traditional fractional CO2 laser. And I have a lot more control of what I can do. And because of that, this has become probably the most popular laser in my practice. She'll recover over the next week, and the skin underneath will glow. So we're excited about this. So we're going to apply some BLT cream. We're going to start at the forehead, and just, you know, this stuff takes a few minutes to kind of really do its job. So we like to have patients come in, apply this, and if they're really, you know, sensitive type patients, we'll have them apply it twice. We'll put it in 30 minutes and put a second coating in, and we really want to just basically treat every area of the face that we're going to laser with the cream. It's painless stuff. This is, you know, non-reactive, and the longer it sits, the better. So we try to have our patients kind of come and just, you know, sit and hang out with us for a little bit. And it's not that the laser is painful, but there is some feeling of, you know, a little bit of like a snapping feeling to it.
Snapping feeling.
Well, I mean, it is vaporizing the tissue, right? And so even though it's not doing it with heat, the body does know something is going on.
What does vaporizing mean?
Well, you hit it and
For
it just
people that are named CJ.
well, it basically blasts the skin away like into smoke, and then we suck it up in our smoke sucker. So
Okay.
yeah, it's good stuff. I mean, in order to kind of heal skin and rejuvenate skin, you have to do controlled damage, and a lot of people like to do peels. Peels are a little, look up for me for a second. Peels are a little bit inaccurate. They can look all the way up. They can be too deep and you can get into problems. And one of the things that I used to do when I first started out, before I was able to buy lasers, and you start out from residency, you're pretty much broke as a physician. You get paid, when I was working, I think it was like $35,000 a year. And you got all these school loans, so you come out, I'm gonna do a little your upper lid here as well. Okay. You come out and, I got you.
Coming soon, CJ 2.0 third edition, but we won't let you guys worry about that right now.
Yeah, you come out of training and these lasers are really expensive and nobody wants to loan you money. So when I started out, I was doing a lot of what they call chronoil phenol peels, which were like these really heavy duty peels that somehow have gotten a resurgence because they're so dramatic. And the problem with those peels is that they can leave the skin with a sort of ashen look. Close your eye. And it's this kind of grayish tone, because what the peel does, it actually is toxic to the pigment cells.
Oh my gosh.
And they look great the first few months. They look kind of like, reddish, but that's mostly the inflammation. Look up for me. But after about 6 months to a year, everything starts to look like it's gray. And I was really, not happy with that. The skin looks good, but the person doesn't. Does that make sense? So these lasers really prevent that, and it's really helpful to have technology that allows us to get great results without the consequences or the risks of other things that have been used in the past. And nowadays I see all these influencers talking about chronoil peels, but the reality is, the initial results look great, but you got to follow these patients out for a while, and then you see that, it's different. It's not better. Right, and a lot of things, the one thing that we always try to strive for in our results is better, It looks kind of rudimentary, right? And it's like, wow, doc, you could have done a little bit, individual stitches each way. But you see, as this lines up, if there's tension on one part, the stitches redistribute the tension across the whole baseball stitch. So you don't get any one area that's too tight. And we have that deeper layer of suture underneath that's going to hold it. Now, her lip is really swollen because we did a little dissection down to get the corners to curl out a little bit, right? And she was concerned about the sides here, so we did a little dissection down to recruit that tissue. and she's swollen. This is going to go down quite a bit. It's not going to be this high, but this is also from a little local anesthesia that we injected in there. But
Sorry. It's okay.
But this is what we call approximate. There's an old saying in surgery: approximate but don't strangulate. Meaning that when you're doing suturing, you want the edges to be just kissing, but you don't want to kind of squeeze them together, because that's where you get tension on the sutures and you get tension on the scar. So this is a nice closure. I think this is going to solve that little bit of tension scar that you had there. And what we'll do is take out these stitches about day 6 or so. Just a little antibiotic ointment a couple times a day. Really easy to take care of this, and kind of easy area to heal for the most part in terms of, you know, you don't need a big dressing or anything like that on it. And that's a lip lift revision. Oh, jeez. It seems like as I get older and I do more of this stuff, I get all the revision work, which I don't mind. Because, like, you know, the first time's easy. The second time, third time, fourth time, when they see a patient who's had things elsewhere, I mean, you have to have been down this road a couple of times to make it sensible. And, like, I've seen everything, not everything, I've seen a lot. And revisions are great, you know, especially when you can just put the final little polish on the apple and just make it what the patient dreams it would be.
Third time's the charm.
Third. Okay, there you go. Okay, and this is another anesthetic.
Oh,
okay. Okay, close your eye. That stinging will last like 10 seconds or less. Okay?
I'm bad with regular eye drops.
Okay, close your eye. So this is a dilute vinegar soak. So it's a very nice antiseptic. Cuts down on inflammation. It the skin's a little bit open right now, so we want to be very careful about what's on it. The vinegar soaks are antiseptic and they cool the face a little bit. They're really nice. They feel good. And we'll have the patients do this through the night for the first night, or do it throughout the day for the first day. Kind of lock in the moisture. So we just wrapped up the laser portion of the procedure. We did the correction of the lip scar, and her lip looks crazy right now. Okay, so I don't want people to think that this is the result, but we had injected this with quite a bit of local anesthetic to keep her comfortable, and there is swelling that occurs. We took a thin strip of tissue. It had to be about 2 millimeters, 3 millimeters at its widest. So we're not going to see a lot of long-term change here. We'll get a tiny little lift, and the other thing is that we'll get a little lift in the corners here because I dissected down to kind of allow that lip to roll over and kind of come up and out where it was a little bit hidden there. But this lip right now is super swollen from the anesthetic, from the surgery, from the swelling, and that'll go down. You can see that we've covered her face in a little bit of antibiotic ointment, and this is a recovery phase, all right? So it's scary looking, as it is, it'll all go down. It takes a couple days and she'll be fine. Believe me, like if you see what we took out in the video compared to the swelling, it's completely unrelated.
Well, that's unfortunate.
What do you think?
It's a vast improvement.
Well, that's good. I'm glad you think that's the scar is going to be great. The swelling, you got to give it a couple days, okay. All right? And usually we say, sleep elevated. In this case, we want you about 30 degrees. We don't want you fully up because we want some of that swelling to go back up into the cheek, okay? Okay. Yeah.
All right.
We'll clean up the betadine around the neck and then get you home, okay?
I'm very excited. Thank you so much, Dr. Korsandi. Another job well done. And there's what more can you say? Looking like this, guys.
Tumbling. No using straws, and because when you use a straw, you're doing this. Yeah. This is why as patients age, we see a lot of scalloping and lines, and they're not smokers' lines; they're straw lines.
Okay.
So especially with this, if you try to use a straw, you're gonna put tension on that. Yeah.
Okay.
You don't think this is gonna scare people away? I mean the process. Right?
It's a little scary to see, but honestly, I'm sure this is gonna go down by tomorrow a lot, and then from there I'll just continue healing. This is the real side of plastic surgery. I think this is sometimes why it upsets people, because you see me, it's scary, I look uncomfortable, I look in pain, I am.
You look crazy, yeah.
I look crazy, but I'm so excited to see the results. I did this of my own volition, and honestly, this is just something that I feel very grateful I'm able to do, and this is what a lot of celebrities are doing, a lot of influencers, and they're not sharing this with you. And this is an important reminder that I don't just wake up and look like this. I have help. And so yeah, I want to be transparent. I think it's very important, and I truly wish more people would be transparent. And they're not transparent because it's a little scary, but I feel great, and I'm just really excited for the final result. And I'm very grateful for this little tiny breast implant that I'm
stress ball
squeezing the whole time. And I'm gonna stop talking now because I probably shouldn't be talking very much. But thank you so much again, Dr. Khorsandi. And I'm very, very excited to be able to share this with you guys. So like, comment, subscribe. Let me know how crazy I look on a scale of 1 to 10, and I'll see y'all next time.
See you guys.